Am I ready for a facelift? I'm 42 and worried about my jowls. I've had voluma fillers in my upper cheeks and nasolabial folds, but I don't feel like it's helping that much. Am I ready for a facelift? A mini facelift? Any other options? Thanks.
Thank you for your question. You're 42 years old, and in your question you describe that you've had voluma used in the upper face and cheeks, and you're concerned about your jowls, and you state that it hasn't helped much. And you're asking whether you're a candidate for a facelift or a mini facelift. Well, I can certainly advise you or guide you with how we approach patients like yourself in our practice. I'm a board-certified cosmetic surgeon, which is a differentiation from board-certified plastic surgeon. The American Board of Cosmetic Surgery is the main organization dedicated specifically towards the training of the specialty of cosmetic surgery. In addition, I'm also a fellowship-trained oculofacial plastic surgeon, and this is a specialty where we focus on training of the surgery of the eyelids and the face. And I've been in practice in performing cosmetic surgery for over 20 years in Manhattan and Long Island. So I can certainly give you a lot of guidance based on my experience. And at age 42, a lot of times this is a threshold period where there are some manifestations of facial aging that can be interpreted or overinterpreted. And so what I mean by that is that facial aging is essentially two processes. One is volume loss, one is descent. So when you talk about a facelift, you have to think that is your skin soft tissue, has it descended? From the photo you submitted, I would say that it's not likely. That what you're interpreting as a jowl is an area we refer to as the mandibular notch. And the mandibular notch is an area of the mandible or the jawbone where the bone actually indents. And there may be some volume descent or accentuation of the jowl right behind it, and it makes someone look jowly. So when we see patients, very often they'll be in front of a mirror and they do what's called a mirror lift. They bring their skin up and they go, look, doesn't that look better? Well, when we do a physical examination, when I perform a physical examination, I look to see, does the skin move? Is there slide? If there isn't, then a lift, regardless of the name, whether it's a mini lift, short scar, smash lift, deep plane, whatever you want to call it, is simply not indicated. Now, when you mentioned the issue with the voluma in the upper face, I can tell you that a lot of doctors try to perform, and I don't mean any disparagement to your doctor, but they try to do something called a liquid facelift, where they try to add volume in the soft tissue of the face to try to expand the face in a way that creates the illusion or, in their mind, a perception of actual lifting. Well, I can tell you as someone who performs a procedure called a Y lift, which is more about structural volumizing, and I'll explain that in a moment, there is a problem in that concept of liquid facelift as it is traditionally practiced. And that is simple. When you are adding volume in areas that have volume loss, where there is value to that, but what is the problem is that when the volume is placed, if the volume is too heavy, it causes the cheek to descend. And if it isn't, and if it's just to replenish volume that's lost, then you're actually going to just have correction, but you are not going to get the effect of lifting. With the Y-lift procedure, what we're doing is we're using traditional dermal fillers, but at a deeper level against more solid structures. And so against the bone structure, you can actually get that lifting effect. But by doing this at a deeper level in a very specific way, we get very nice natural looking results. We can actually use a lot of filler, considerably more than is used in a traditional volume correction, which averages anywhere from 1 to 4 syringes. In a Y-lift procedure, we can use 14 syringes. Now that's when we do a full face. But for someone like yourself, I could see improving this area with the Y-lift method to improve the jawline, and I think you'd be impressed with the result. So I think that you can move away from the idea of going towards surgical lifting, because the other thing that's important to understand is that even when you lift, you don't necessarily fill that area unless you're doing a filling procedure concurrently. And those filling procedures include fat grafting or placement of some type of implant, such as a pre-jowl implant that's a silicone implant similar to a chin implant, or a chin implant just the same. That's also an option. But I think you could probably buy some time before doing that and consider this method called the Y-lift. There's only a specific group of people who are Y-lift trained physicians. So when you do your research and learn more about it, identify the right doctors before you go and just go for another, like a liquid facelift type of consultation. So I hope that was helpful. I wish you the best of luck. Thank you for your question.